Survival from cardiac arrest requires quick recognition, rapid response, early defibrillation, and ACLS intervention. Understanding the operation of your Zoll M-Series before you encounter an emergency situation will enhance your potential to save victims of cardiac arrest. Users should review the first M-Series in-service video for basic operation of the M-Series for manual defibrillation, advisory function, electrode placement, and proper battery maintenance. This second program will introduce you to the Zoll M-Series with Zoll's low-energy rectilinear biphasic waveform, AED function, and additional monitoring parameters including pulse oximetry, 12-lead ECG, end-tidal carbon dioxide monitoring, and non-invasive blood pressure. M-Series are now available with a choice of 2 defibrillation waveforms. Some M-Series are equipped with a monophasic waveform, and some offer Zoll's new low-energy rectilinear biphasic waveform. The rectilinear biphasic waveform offers superior defibrillation capabilities at lower energy settings. The suggested 3-shock VF protocol for monophasic waveforms is 200, 300, and 360 joules. The suggested biphasic 3-shock VF protocol is 120, 150, and 200 joules. Successive low-energy shocks should remain at 200 joules. Recommended pediatric settings should remain consistent with monophasic joule settings. Users should consult your medical authority to confirm pediatric settings. Biphasic energy levels for internal defibrillation should also remain consistent with monophasic protocol, unless otherwise directed by your medical authority. This video depicts the use of biphasic defibrillators. Other than energy levels, there are no operational differences between biphasic and monophasic M-Series devices. The M-Series defibrillator monitor is capable of analyzing a patient's ECG to identify if a shockable rhythm exists when using multifunction electrode pads. To use the AED feature, the selector switch must be turned to on. The M-Series is capable of analyzing a patient's ECG rhythm in 2 different ways.
Stand clear.
The first is always active in the semi-automatic mode, when MFE pads or ECG cable and electrodes are in use. The second is user-activated,
Stand clear.
initiated by pressing the Analyze button. The M-Series AED may be configured to automatically analyze on power-up. Also, the M-Series may be configured to automatically charge if a shockable rhythm is determined.
Press shock.
Consult your M-Series operator's guide for detailed information on ECG analysis and automated external defibrillator operation. To use the AED in the semi-automatic mode, verify the patient is unconscious, not breathing, and pulseless. Request assistance, begin CPR, and remove clothing covering the patient's chest. If not pre-connected, connect the MFE pads to the multifunction cables. Apply the MFE pads according to directions on the package. Pads may be applied in anterior-posterior or apex sternum positions. Ensure that all MFE pads are making good contact with the patient's skin and are not covering any part of the ECG electrodes. Set the selector switch to on. The unit will beep 4 times to indicate that it has passed the power on self-test. If the audio recorder is present, the unit will begin recording audio data.
Attach pads.
On power-up, the message and voice prompt, Attach pads, will be issued if ECG electrodes or MFE pads have not been attached to the patient.
Check pads.
If the pads become detached or the connection is broken, a Check Pads message and voice prompt will be issued. Biphasic M-Series defibrillator default settings are shock number 1 at 120 joules, shock 2 at 150 joules, and shock-free and up set at 200 joules. If your M-Series utilizes a monophasic waveform, default settings are 200, 300, and 360 joules. If medical protocols allow, the operator may select any of the pre-configured energy levels using the Energy Select up or down arrow buttons. The new energy level will display on the monitor. Press the Analyze button to begin the analysis of the patient's ECG rhythm.
Stand clear.
A Stand Clear message and voice prompt will be issued. An Analyzing ECG message is then displayed while the patient's ECG is analyzed. If MFE pads have not been properly connected to the patient, a Use Pads message will be displayed and analysis will be inhibited. Warn all persons attending the patient to stand clear.
Stand clear.
No one should touch the patient, bed, or any equipment connected to the patient during defibrillation. A severe shock can result. When analysis is complete, the unit indicates whether or not a shock is advised.
Stand clear.
When a non-shockable rhythm is detected, the No Shock Advised message and voice prompt are issued.
No shock advised.
Immediately check the patient's pulse and breathing, and resume other treatment per protocol. If the patient's rhythm is shockable, the unit will display a Shock Advised message.
Press shock.
If so configured, the defibrillator will automatically begin charging to the pre-selected energy setting and display a charging message.
Press shock.
When the unit is charged and ready, the shock button will illuminate and the Press Shock message and voice prompt will be issued.
Press shock.
Press and hold the shock button on the front panel until the energy is delivered to the patient. Observe the patient or the ECG response to make certain the shock has been delivered. A continuous tone will sound for 10 seconds, followed by an intermittent beeping for 5 seconds. The shock must be delivered within this 15-second interval, or the defibrillator will disarm itself.
Press analyze. Press shock.
After the shock,
Check pulse.
the display returns to the energy selected and indicates the number of shocks delivered to the patient. Press the Analyze button to restart an ECG analysis and determine if additional shocks are required. If so configured, the M-Series will automatically analyze and recharge.
Press shock.
The unit uses both audio and visual prompts to present critical information to operators. Please consult the M-Series Operator's Guide for detailed information on voice prompts and operating messages, which can occur during semi-automatic operation. If your device has been custom configured, some information may be different. Press the Manual Mode soft key on the front panel of the unit to enter the manual mode of operation. If the confirmed soft key is not pressed within 5 seconds, the unit will revert to semi-automatic operation. If the M-Series has been configured to require an access code, Enter Access Code will be displayed, and the operator will have to enter a 3-digit access code by pressing the soft keys corresponding to the correct digits. If the MFE pads are not making good contact, or if a short circuit between the pads exists, 2 messages, Check Pads and Poor Pad Contact, will be alternately displayed, and energy will not be delivered. Please refer to the previous in-service videotape and M-Series Operator's Guide under Manual Defibrillation, Advisory Defibrillation, Pacing, and ECG Monitoring sections for the appropriate detailed instructions for operation in the manual mode. M-Series defibrillators may be equipped with Masimo's patented set pulse oximetry technology, which offers superior performance during motion, low perfusion, and high ambient light conditions. For detailed instructions on proper sensor size, application, and detailed operating instructions, please see the pulse oximetry insert in the M-Series Operator's Guide. To use the M-Series with SpO2, attach the SpO2 cable to the Massimo connector on the rear of the M-Series. Plug the sensor into the SpO2 patient cable. The reusable sensor is simply placed over the appropriate site. Attach the sensor to the patient. Choose a site that is well perfused and one that is least likely to restrict patient movements. The ring finger or middle finger of the non-dominant hand is preferred. The disposable sensor should be placed by carefully following the instructions on the package. Turn the M-Series selector switch to on if you are using an AED, or to monitor for advisory and manual devices. A dashed line will be displayed in the SpO2 field until a pulse is detected. Once the measurement has been established, the saturation values will be displayed in the numeric window. If ECG leads or pads are not attached, the patient's pulse rate, as measured by the SpO2 sensor, will be displayed as the heart rate in the ECG field. When the parameter soft key is pressed, the Select, Enter, and Return soft keys will be displayed. Pressing the Select soft key allows you to scroll through different physiologic parameters, if available. Selecting the SpO2 soft key causes the following soft keys to appear: Sensitivity, Average, Alarms, and Return. The Sensitivity soft key allows the user to select either normal or high sensitivity for SpO2 monitoring. The normal setting is recommended for most patients. The Average soft key provides 3 different time periods over which SpO2 values are averaged: 16 seconds, 4 seconds, 8 seconds, which is the default setting. The Return soft key returns the operator to the previous screen. If desired, the user can select a plethysmographic waveform by pressing the Wave 2 soft key until the desired waveform is displayed. If the monitor is equipped with end-tidal CO2, the ETCO2 waveform will be displayed with the first press of the Wave 2 soft key. Pressing the Wave 2 soft key again displays the SpO2 waveform. Press the Alarms soft key to display the Set Alarm screen and corresponding soft keys. This screen allows users to enable or disable alarms. Consult the Operator's Guide for detailed instructions on alarms, their priorities and limits, and how pulse oximetry operates in AEDs.